Okay, so this is the femur. It is the long bone in your upper leg. This end is the head of the femur. It's got a very long neck, and this rounded head articulates with the acetabulum and the coxal bone. Notice that there is a big bump and then a smaller bump, kind of the same organization we saw on the humerus, but of course different. First of all, these are called trochanters. Canter means running, so trochanters are used for running. The greater trochanter you can kind of feel as a lump on the lateral side of your hip, okay? The lesser trochanter is in the back. Now remember, on the humerus we have tubercles, a greater tubercle and a lesser tubercle is on the front of the humerus. On the femur, the lesser trochanter is on the back. As we go down the femur, there is this rough patch here that is the gluteal tuberosity. That is where the gluteus maximus inserts. And if you're wondering why that isn't a larger marking, it's partly because we get lots of bones from very old people who don't have strong gluteal muscles, and also because it's a larger insertion rather than pulling on one small part. The gluteus maximus inserts kind of on a large piece of this. That then becomes this ridge down the back of the femur called the linea aspera, and that is going to be an attachment site for some of the hamstring muscles. Those are the extensor muscles on the back of the leg. And then down at the distal end of the femur, we have two condyles, the medial and lateral condyle, and up from each of those, there's a little bump called the epicondyle. So remember, epi means on, so this is a bump on the condyle. Okay, so we have a medial condyle on the same side as the head, and the lateral condyle on the same side as the greater trochanter. This is, okay, this is kind of a weird view. This is the proximal end of the femur looking from the medial side. This is the distal end looking up the femur. Okay, so there's the head back there. So looking over here, excuse me, we have the head nice and smooth with a little, this is called a fovea in the middle. There is a ligament called the ligament of the head of the femur that attaches here and contains an artery and vein that actually provide blood supply to the head of the femur. Then we have the greater trochanter, and the neck of the femur is this long extension here. The surgical neck is down here. Remember, the surgical neck is the part that gets broken more often. If somebody breaks the neck of the femur, the true neck of the femur, we actually say that they broke their hip. So if someone breaks their hip, what often happens is they've broken the neck of the femur. If they actually break the os coxae bones, we say they've broken their pelvis. So there's the greater trochanter and the lesser trochanter. And then this is the anterior side here. This is the posterior side would be on the bottom. So we can see the lateral and medial epicondyle, and notice how smooth these condyles are all the way up to here. There's an indentation between them called the patellar surface, and that's where the patella articulates. As you bend your leg, the patella is actually going to move back and forth across this smooth surface. The long part of the femur is called the shaft of the femur. And then between the condyles, this indentation is the intercondylar fossa. The lower leg bone, the tibia, is going to have an intercondylar prominence that fits into this intercondylar fossa. Let me go back here and say one more thing about these condyles. Notice how far back the smooth surface on these condyles go. And that is so that you can flex your knee all the way to essentially bring your heel up to your butt. Okay, so front of the femur has this smooth patellar surface. Back of the femur has the round condyles, and it also has the lesser trochanter on it. And then that's the patella. It's just it's actually a giant sesamoid bone. Remember, sesamoid bones are little bones. They're sort of shaped like sesame seeds. The patella is actually a very large sesamoid bone. The anterior surface is kind of rough. It's actually going to be covered with a ligament and a tendon. The quadriceps tendon goes to the patella, and then it's actually one structure from the patella down. It's called the patellar ligament. On the back, the articular surface is covered in this image with articular cartilage, which of course is our layer of hyaline cartilage, and that's going to enable it to move smoothly up and down on that patellar surface on the femur. All right, so that's that. In the next video, I'm going to talk about the tibia and the fibula.